sitting in Delhi would be able to operate on a patient in Nairobi. Yes. The only problem right now is a time lag of about 2-3 seconds, which may be important in case there is a bleed. But otherwise, it's very much possible. And something like this was tried in Paris, and the only reason they couldn't continue with it was because of the time lapse. So tomorrow we don't know, they might get hold of this time lapse problem, and then even though the robot is in Delhi, people will be operated here locally.
Dr. Saxena will sit in Delhi
and operate on
with his joystick
in a Nairobi hospital.
Absolutely, that's technology for you.
That's technology.
Okay.
Yeah, it's only the internet that was a bit slow, maybe in Paris.
So another thing that you mentioned was a big problem is in the event of a bleed.
Yes.
So then how do you handle a bleed?
We always tell our patients that there is a small percentage where we might have to convert it into laparoscopic or even open. Because you cannot guarantee for any operation. Whether you're a robot or not, there are a certain percentage of cases who will not do that as well as the others do. So we tell them about this, but touch wood, I haven't had any problem up to now on that account. But yes, in case there is a major bleed, then there is...
You have to open
it up. And we've got all open instruments already set up in the theatre.
In the event.
There is another surgeon who's standing by the robot, and he very quickly opens up the...
Okay, all right. So for you, Simon, who you can give us a very small brief of what Pathway International does, the organization that you represent. What does this mean for Pathway?
What Pathway does is we're a medical travel company that really focuses on developing doctors. We really work with doctors in Kenya. We believe doctors are the backbone of the healthcare industry, and we want to play our role in Vision 2030 to make Kenya the destination for medical tourists. Right now, India is the destination global in the world. Everybody is going to India, and I, in Pathway, I'm not going to reinvent the wheel. We're going to learn from our partners and bring those technologies to Kenya and provide people with opportunity to even right now be able to go, for example, if it's to India, to go and get this treatment. Right now, if you're sitting here in Kenya, Pathway International can connect you to the best doctor, to the best technologies globally, wherever that may be, because we've done our work, we've done our research, and that's what we do. We connect people who have medical needs that are not locally available in their locality and take them to the place where they can get the best treatment and provide the whole support services
that they would require.
Can I, on behalf of Apollo Hospital and myself, say to Simon, Karibu.
Asante sana.
Right. So just going on that thread, don't you think that perhaps this introduction of this kind of technology and other forms of very advanced technology would work against Pathway? Because then, you know, people can get what they've been going out for here.
That's a very good question. It will work actually for Pathway 100%. Like I said, our goal is to be the premier medical company, and I think right now we are. Our Vision 2030, medical tourism is a key pillar of the medical sector. Kenya will be the destination. Right now it is the destination. We have some of the finest, best doctors in the region. If you look at places like South Sudan, Juba, Uganda, Tanzania, Rwanda. So Pathway is already bringing patients in from that region into Kenya to, for example, receive laparoscopic surgery. So if I was in a different locality, I'd be talking about laparoscopic. If I was in Uganda, for example, I'd be talking about... So Pathway is actually ideally placed to ensure that we continue developing Kenya's skill set. So Kenya becomes, that's one of our biggest pillars, is to develop Kenya as the institution. 30 years ago, Apollo did not have, India did not have MRI. Apollo did not have, could not do any cardiology procedures. They had never done kidney transplants. That's 30 years ago, 1983. I'm sure that was way before you were born, Marianne. But in 1983, India was behind. MRI. Now, Kenya has over 10 MRIs. Nothing is impossible. I believe nothing is impossible. People out there may be saying robotic surgery is out there. It's something that is far. but I truly believe it's something that can be achieved, and actually even that time shortened and develop that skill set and bring that service to Kenyans.
To Kenya.
Here in Kenyans and also people in the regions.
In the region.
And
in
what
essence, bringing it to Kenya, you've brought it to the region.
Absolutely, and I'd say we've partnered with Pathway International and Apollo Hospitals have partnered to even develop we have an Apollo Information Center here in Kenya, where people can be able to come in and access Apollo services, talk to Dr. Saxena, get advice if you need to travel. We're able to provide all that with our partners. So I think the future is looking bright, and technology is going to definitely make it brighter.
Yes. All right. So we talked about the cost. You talked about 500,000 shillings for a standard prostate surgery.
Yeah.
How about the equipment? What would a Kenyan hospital need to invest to get it here?
I think that the patent right now is very high. Because of the patent laws, it's a bit expensive. So I think it's, if I'm correct, we were discussing that and debating what the actual cost was. I would take a rough guess. It's about 1 million to 1.5 million for the machine. Each arm, is it
$1,000?
$1,000.
Each arm.
Yeah, that's what makes it actually a bit expensive.
3 or 4 arms in one operation.
And those are discarded, they're disposable. So when you talk about doing the prostatectomy at 6,000, so if, for example, he'll use 3 of them, that's 3,000 for those pieces. Obviously, with more production, as people develop more Nokias and so forth, that cost will go down.
Will go down.
Yeah, so that's why it's a bit expensive.
Yeah.
Yeah.
Okay, so about 1 million. So you're saying...
And sorry, and maintenance for the machine right now is pretty high.
Ah, okay.
Yearly, I think the machine to maintain is 100,000. Which is about 8.5 million Kenya shillings. Whether you do 1 or 100, 200, the annual cost for maintaining that machine is 8.5 million Kenya shillings.
So that is what would make the cost for the patient very, very high.
Right now, it would. But that cost, I think, the learning curve will make that cost as they learn. People produce more. That cost will definitely come down.
Will definitely come down.
Yeah.
Okay, Dr. Saxena, you mentioned something about discarding the arm.
Right.
So you're saying that machine comes with about 2 or 3 arms which have to be discarded after every surgery.
Some people do that, but what the company has done is that they can allow 10 uses of that instrument, and then it comes down. The cost comes down a bit, but the computer keeps on calculating.
Oh, okay.
So you try and cheat on the computer, you can't. After 10, it won't work at all.
After 10 uses,
you have to discard it.
Okay, and so then you have to get fresh arms for
for
every
cases.
set of 10.
That's again a bit of a problem because we don't have very many arms for many surgeries. But what we are able to do right now is prostate, pyeloplasty, which is an operation on the kidney, nephrectomies, removal of kidneys, partial removal of kidneys, in vesicovaginal fistula, which is quite a big problem. There we can use the robot. So the various uses of robot are coming up as it gains popularity, and we'll be able to have many more arms and hopefully cheaper arms.
More features.
More features.
Yeah, I think it's very simple. Like the phone that you used to have, they add more features.
Initially had very few features.
Yeah, now Apple has sliding and so forth. You can do so many things with them. I think the robot will have more features as...
I like the comparison. It's pretty good.
Yes.
As time goes by.
Yeah.
Yes.
Right. All right, let's take a very short break. Viewers will be taking a very short break, but we'll be right back talking about this very fascinating robotic surgery.